And all this morning and all day, actually, we're looking at how the NHS in Cumbria is preparing for winter. So we've heard about the new project aimed at keeping adults in Cumbria out of hospital where possible, about the vaccination schemes aiming to protect us from things like flu, and from one of the men in charge of keeping the NHS running in our county through the winter. So what we're after now is some practical advice about what we can do to stay safe this winter and where to get the help we need if we do find ourselves struggling. Let's head back to BBC Radio Cumbria's John Bowness, who's settled into a GP practice in Carlisle for this morning. Hello, John.
Hello again, Steph. Yes, I'm joined again this morning by Dr. Robert Westgate, who's GP and Clinical Director here at Carlisle Healthcare. So it's a very large practice on the sort of southeastern part of the city. He's been looking after me this morning. He's been feeding me some updates and some stats and details, and we'll get some of those in a moment. But here they look after, across their 3 sites, 40,000 patients, or more than 40,000 patients. So we're talking a very big practice here. Dr. Westgate, Dr. Robert Westgate, just update the stats for us if you would, because about an hour or so ago we were talking about something like 200 people who'd been in touch already this morning, needing appointments and advice. How's that going now?
Yeah, so it's shaping up. It's a fairly normal, busy Tuesday morning. So as of 11 o'clock, we'd had about 162 people contact us on the phone, 224 people contact us online, and that's a fairly normal Tuesday morning. So I'm just doing my sums there. That is looking at sorry, my mental arithmetic has gone over 300 contacts in the first few hours this morning. That will tail off as the day goes on. And
it's interesting that it's far more online. The balance has already sort of tipped that way.
It is. I mean, we've been using online to assist access for a number of years, and our average is around 3/4 of people contact us online, and the remainder contact us either as a walk-in or via the telephone.
OK, we're also talking this morning about winter pressures as well, and the NHS is obviously well known as facing a lot of problems in the winter time. We talk about things like problems with respiratory conditions, people with slips and trips on ice and so on, with winter colds as well. What do we mean by all that, though, and how much pressure does all that put on the NHS?
No, thank you. I think it's fair to say that it feels as though we're under pressure and the NHS is under pressure right through the year. But we do see a surge in winter, particularly around respiratory infections, around flu season, maybe about a 10% increase in demand and activity. So it does put a strain on the system. The system is under pressure. There is some additional NHS resource that comes into general practice to allow us to put on some additional capacity to support seeing people with respiratory infections when they need to be seen. But it's a huge strain on a system that's already under pressure.
And how do you sort of prepare for that? And how much do you sort of dread it, a big surge of work and pressure?
A lot of the patterns of behaviour when you look at populations are fairly predictable. So we plan as best as we can to have the capacity that we need to meet the perceived demand or the expected demand for the season. But what that means is we will devote so much capacity to same day or urgent type response, and that means that it's harder to get a routine appointment or a bit further in the distance to get a routine appointment for something that may be important but not so urgent. So we can't offer the service that we would like to everybody because the acute episodes of illness that we need to deal with or support people with sort of trump the more planned, albeit important, aspects of care.
Let's look at advice for people. There's a lot of work being done about getting patients to the right part of the NHS or the right person here for the type of care that they need. If someone is feeling unwell in winter, who should they be speaking to first? What should they be doing first?
Well, the first thing is probably around self-care. So the vast majority of people that have a winter bug, it will get better by itself. It will be self-limiting. A cold will run for a few days. A cough might run for a few weeks. But if someone's generally well in themselves, home remedies, be it paracetamol for aches, pains, fevers, drinking plenty of fluids, having a bit of time out if you need to, etc. Those are all very reasonable things to do. Community pharmacists can be of great assistance for minor ailment remedies, as well as the Pharmacy First scheme, which we'll maybe look at a little bit later on with our clinical pharmacist. But in terms of contacting the surgery, people at extremes of age, so very young folk, very old folk that have worsening symptoms or concerns, really important to seek medical advice. If a cough is going on for more than 3 weeks, important to get an opinion. Losing weight for no apparent reason, weakened immune system or medications that weaken immune systems. Urgent appointments in general practice. If a cough is getting worse very quickly. For example, hacking cough, can't stop coughing, getting breathless, feeling unwell. These are important reasons to seek same-day medical advice. But preparedness, self-care, resilience, community pharmacy, GP, and obviously 999 for life-threatening emergencies.
Because after, particularly, I suppose, the pandemic, and people sometimes feel a bit reluctant to get in touch and to see their doctor or whatever. I mean, Cumbrians are probably fairly well known as being as well for not wanting to bother the doctor in some cases, and don't want to be a burden on the system. What would you say to anyone who was maybe veering in that direction but was a bit unwell?
Thank you. Now, I think personal resilience is really important, and absolutely fine if you feel generally well in yourself, got some symptoms, they're running for a week or two, that's absolutely fine. But the cough that's going on for more than 3 weeks, the symptoms that are worsening, associated weight loss, associated concerns, etc., those are important things to seek advice on. But the vast majority of winter bugs that most people will get will be self-limiting without need for any medical intervention.
OK. You've got nearly 200 staff across your 3 practices here. And you obviously come across people with colds and flu and other things that could be infectious all the time. How do you look after your own staff and make sure they stay as healthy as possible over winter?
Well, first of all, we have to recognise that all our staff, all our colleagues are as regular people too, and they will have episodes of illness. So we need to factor in that there will be a degree of sickness absence across the year, and particularly during the winter season. But things like personal protective equipment, the option to use face coverings, etc., when dealing with people with respiratory illness, hand washing facilities, all these sorts of things are really important. The other things, that the strain, the pressure of the day, and creating a job that people want to do rather than a job that is too stressful for people to do is really, really important. So we try to shape the day for our colleagues, our clinical staff, our admin teams, etc., to allow them to do the job and to do the job well. We've got a lot of staff working really, really hard to provide the best they can in a system under pressure, and we need to support them to do that.
OK, for now, thank you very much, Dr. Robert Westgate, who's the GP and Clinical Director at Carlisle Healthcare. In the next sort of half an hour or so, Steph, I'm going to be speaking to a clinical pharmacist who's based here to get a bit of advice about the kind of help you might be able to get from your local pharmacy or chemist.
Brilliant. Thank you very much, John Burness there. We will be heading back to John, as he said, to Carlisle Healthcare on Locke Road in South Cumbria a little bit later on this morning as we continue to get a snapshot of what's going on in Cumbria to prepare the NHS for what is predicted to be an incredibly busy winter period. So more with John in just a little while. It is 25 minutes past 11. It is Steph with you.